Diphtheria has reappeared in Yemen's Ma'rib province, alarming health officials as the city struggles with a collapsing health system and an influx of displaced families. Authorities have recorded dozens of suspected cases and several deaths among children. The Fang report has more details.
After years of disappearance, diphtheria has returned in a worrying way amid the collapse of the health sector and shortage of medical resources. The disease is placing a heavy burden on the city of Ma'rib, which is already hosting thousands of displaced families from other provinces. According to a report from the Ma'rib Office of Public Health and Population, around 57 suspected cases of diphtheria have been recorded in recent months, including 4 deaths, all among children. Health officials fear the disease could spread again, especially among vulnerable groups.
The number of cases in Ma'rib Governorate has reached 57 suspected diphtheria cases, and fortunately 4 of them have died. Most of the deceased and infected cases were not vaccinated, which reflects negatively on the parents who did not ensure their children were vaccinated during childhood or at the scheduled times according to immunization schedule. What we hope for from parents and urge as well is to make sure that children are vaccinated because there is no treatment for this disease.
The office said that the lack of medical support and the reduced response from health organizations have contributed to the return and spread of the disease in recent years. Crowded areas hosting displaced people, which lack basic health and prevention services. The province also struggled to provide vaccines and medical supplies, limiting its ability to contain the outbreak.
Diphtheria is considered a bacterial disease that affects the respiratory system. It can also be diagnosed by the presence of membranous layer in throat that affects breathing, followed by a rise in body temperature and difficulty swallowing. The way to prevent it is through vaccination and protective measures, especially for children whose immunity is weak.
Many residents, especially low-income families, are worried about the continued spread of diphtheria without urgent actions from the health authorities and international organizations. They fear the disease could reach more people and cause more death. In overcrowded areas and displaced camps where health services are very poor, citizens are calling on health authorities and aid organizations to quickly launch vaccination and awareness campaigns to protect children and the community from this preventable